When I speak to women over 50 about sexual wellness, the first thing I want them to understand is this. What you're experiencing is not simply aging in the way most people think. It's a combination of hormonal, emotional, and physical changes that are completely natural, but often misunderstood. Too many of my patients come in feeling as though their bodies have betrayed them, as if intimacy is supposed to decline and there's nothing they can do. That's simply not true. The reality is that the changes you feel can be understood, managed, and even turned into an opportunity to deepen your relationship with yourself and your partner. But to do that, we have to talk honestly about what's really going on. One of the most significant changes for women in this stage of life is the decline in estrogen. Estrogen doesn't just affect fertility, it plays a huge role in vaginal health, sexual desire, and even mood stability. Lower levels can cause dryness, thinning of the vaginal walls, and reduced elasticity, which can make intimacy uncomfortable or even painful. This discomfort is one of the biggest reasons women avoid sex. But here's what many don't realize. You have options. There are safe, effective treatments, from vaginal moisturizers and lubricants to low-dose localized estrogen therapy, that can restore comfort without affecting your entire hormonal system. The problem is, most women aren't told about them until they ask directly. Desire itself also changes, but not always in the way people assume. Yes, hormonal shifts can reduce libido, but so can stress, lack of sleep, certain medications, and relationship dynamics. In fact, I often find that emotional and mental factors have a stronger impact on desire than hormone levels alone. When you're dealing with work stress, family changes, or health concerns, intimacy can slide down the priority list. This is why sexual wellness after 50 has to be looked at holistically. You can't just treat the body without supporting the mind. Sometimes the first step toward restoring desire is simply creating more space for rest, pleasure, and self-care. Body image is another unspoken factor. Many women tell me they feel less confident in their bodies as they age, comparing themselves to younger versions of themselves or to unrealistic media images. This self-criticism creates a mental block, making it hard to feel open or sensual. I remind my patients that attractiveness and sexual energy are not about looking 30 again. They're about being comfortable in your own skin now. Confidence comes from taking care of your health, wearing clothes that make you feel good, and engaging in activities that remind you of your strength and value. When you treat your body as worthy, it responds in kind. Communication is perhaps the most underrated part of sexual wellness. Many women hesitate to talk to their partners about changes in their bodies, fearing rejection or misunderstanding. But without communication, partners are left guessing, and often guessing wrong. I encourage my patients to speak openly about what feels good, what's changed, and what they need. Intimacy is a shared experience, and when both people feel informed and connected, the physical side becomes more natural and fulfilling. You don't have to present a problem as a complaint. Instead, think of it as an invitation to explore new ways of connecting. Finally, I want to say this. Sexual wellness after 50 is not about fixing yourself to be who you used to be. It's about understanding the woman you are now and giving her the attention, care, and respect she deserves. Your needs, desires, and rhythms may have changed, but that doesn't make them less valid. It makes them richer, more nuanced, and often more deeply fulfilling. The women who thrive in this stage of life are not the ones who chase the past, but the ones who embrace the present with openness and curiosity. And that's exactly what we're going to explore together as we go deeper into this conversation. If you want, I can now move into part 2, where we'll dive into specific physical strategies, daily habits, and exercises that improve sexual comfort, blood flow, and confidence for women over 50, keeping it connected seamlessly to part 1 so viewers don't feel the break. In our last discussion, I talked about the changes that often happen to women's bodies after 50 and how understanding them is the first step toward reclaiming your sexual wellness. Now, I want to focus on what you can actually do, practical, real-life steps you can start right away. And I'm not talking about quick fixes or gimmicks. I'm talking about daily habits that create real, lasting improvements in how your body feels, how your mind responds, and how you experience intimacy. These are strategies I've seen work time and again with my patients, and they're not complicated, but they require consistency. The first area we need to address is blood flow. Good circulation is essential for sexual health. It helps with arousal, sensation, and even natural lubrication. Unfortunately, as we get older, we tend to move less, and that lack of activity directly impacts our intimate wellness. I often recommend simple, low-impact exercises like walking, swimming, or cycling for at least 20–30 minutes a day. Yoga and Pilates can also be excellent because they improve flexibility, strengthen core muscles, and increase pelvic blood flow. These movements are not just good for you, they physically prepare your body for a better intimate experience. Speaking of the pelvic area, strengthening the pelvic floor is one of the most valuable things you can do after 50. A strong pelvic floor supports bladder control, enhances sexual sensation, and can make intimacy more enjoyable. Kegel exercises are the most well-known, but many women either do them incorrectly or forget to do them at all. The key is to focus on controlled contractions, tightening the muscles you'd use to stop urination, and holding for a few seconds before releasing. I often recommend starting with 5 to 10 repetitions twice a day, gradually increasing as your strength improves. It's such a small habit, yet the benefits over time are remarkable. Next, we need to talk about skin and tissue health. Lower estrogen levels can cause dryness and thinning of vaginal tissues, making intimacy uncomfortable. This is not something you should just live with. High-quality lubricants and vaginal moisturizers can make a big difference, and for some women, localized estrogen creams or suppositories prescribed by a doctor can restore tissue health. I always tell my patients, don't wait until discomfort becomes pain. Address it early. Maintaining tissue elasticity isn't just about comfort. It's about keeping your body responsive and capable of pleasure. Another crucial piece of the puzzle is energy. If you're constantly exhausted, your body's first priority is going to be rest, not intimacy. Many women underestimate the effect that poor sleep, irregular meals, or nutrient deficiencies have on their sexual health. Balanced nutrition with adequate protein, healthy fats, and vitamins like D, B-complex, and magnesium can boost energy, improve mood, and stabilize hormones. I also advise limiting alcohol and sugar, as both can affect circulation and energy levels. When your body feels strong and nourished, desire tends to follow naturally. Finally, I want you to think about intimacy outside the bedroom. Many women over 50 tell me they feel switched off sexually, but when we dig deeper, it's because they're not nurturing sensuality in their daily lives. That means small touches, kind words, laughter, and shared activities with a partner, things that build connection and remind your body that closeness is safe and enjoyable. Even if you're single, you can nurture sensuality through self-care, dance, movement, or simply wearing fabrics and scents that make you feel good. Sexual wellness is not just a moment. It's a mindset you build every day. By now, you've heard me say that sexual wellness isn't just about the body. And this is where we start to bring the mind and emotions into the picture. For many women over 50, the biggest shift in intimacy isn't physical at all, it's psychological. Hormonal changes can affect mood and stress resilience, yes, but so can life changes, retirement, adult children moving out, caring for aging parents, or adjusting to a quieter household. These shifts can subtly change how you see yourself, how connected you feel to your partner, and even how much space you allow for pleasure. And without addressing these emotional layers, even the best physical strategies can feel incomplete. One of the most powerful things I encourage my patients to do is to reframe how they think about desire. It's not always spontaneous, especially after 50, and that's perfectly normal. Desire can be responsive, meaning it grows from touch, connection, or simply feeling relaxed and appreciated. If you're waiting for a lightning bolt of passion before engaging in intimacy, you might be waiting a long time. But if you create the conditions for it, time, comfort, emotional safety, you'll often find desire awakens naturally. This mindset shift alone can take a lot of pressure off both you and your partner. Stress, on the other hand, is one of intimacy's biggest enemies. Cortisol, the stress hormone, directly interferes with estrogen and testosterone balance, dampens desire, and makes it harder for your body to relax into intimacy. And after 50, stress doesn't just come from work or finances. It can come from health concerns, family responsibilities, or even self-criticism about your body. This is why I recommend intentional stress reduction practices, gentle exercise, meditation, slow breathing before bed, or even something as simple as stepping outside for fresh air during the day. These aren't luxuries. They're essential for keeping your mind and body open to connection. Now, we can't talk about emotional wellness without talking about communication. The truth is, many couples stop having honest conversations about sex somewhere along the way. They may avoid the topic because it feels awkward, or because they assume their partner should know what they like or need. But I've seen relationships completely transform when partners start speaking openly and listening without judgment. Sometimes it's as simple as saying, "I've noticed I feel more comfortable when we take things slowly," or "I'd like to try something new together." It's not about criticism, it's about collaboration. For women who are single, these emotional factors still matter deeply. Building sexual wellness without a partner means creating a positive, respectful relationship with your own body. That might mean exploring self-touch, investing in comfortable lingerie, or finding forms of movement that make you feel sensual and alive. It's about reclaiming the idea that pleasure is your right, not a privilege tied to someone else's presence. In my experience, women who feel comfortable with their own sensuality tend to have healthier, more satisfying relationships when they do choose to connect with someone. The bottom line is this: intimacy after 50 can be richer, more relaxed, and more fulfilling than ever, but only if you let go of outdated expectations and make space for both your body and mind to adapt. When you address the emotional side of sexual health with the same attention you give to the physical, you stop chasing a past version of yourself and start enjoying the woman you are now. And in my years of practice, I've seen that's when the real magic begins. Once we understand the emotional foundation of sexual wellness, the next step is to make sure the physical experience itself is comfortable, satisfying, and something you actually look forward to. Discomfort during intimacy is one of the most common reasons women over 50 begin to avoid it, and yet, in so many cases, it's entirely preventable. Pain, dryness, or a feeling of tightness aren't simply signs that it's over. They're signals from your body that it needs support. And if we listen to those signals early, we can make small adjustments that change the entire experience. One of the simplest, most effective adjustments is using the right type of lubrication and vaginal moisturizers. Not all lubricants are created equal, and many store-bought ones can actually irritate sensitive tissues if they contain glycerin, perfumes, or parabens. I recommend looking for water-based or silicone-based products that are pH-balanced and specifically formulated for vaginal health. Moisturizers, unlike lubricants, are used regularly, even when you're not planning intimacy, to keep tissues soft, hydrated, and elastic. These two tools alone can remove a major barrier to pleasure for many women. For those dealing with more significant changes, localized estrogen therapy can be a game changer. This isn't the same as taking systemic hormone replacement. It's a low-dose treatment applied directly where it's needed, usually as a cream, ring, or tablet. It works to restore the thickness and elasticity of vaginal tissues without sending large amounts of estrogen throughout the body. Many of my patients are surprised by how quickly they notice a difference, not just in comfort, but in confidence. When intimacy no longer feels like something you have to get through, it becomes something you can genuinely enjoy again. Beyond comfort, it's worth exploring new forms of pleasure and stimulation. Our bodies change with age, and that can mean adjusting how we approach intimacy. Some women find they need more time for arousal, more gradual touch, or different positions that reduce pressure on joints and muscles. This is not a sign of decline, it's simply adapting to a new chapter. In fact, I've seen couples who, in learning to slow down and experiment, discover deeper levels of connection than they ever had before. The key is to approach intimacy with curiosity, not obligation. Your overall lifestyle plays a massive role in this as well. The same habits that improve heart health and energy levels, regular physical activity, balanced nutrition, proper hydration, also directly impact your sexual wellness. Foods rich in omega-3 fatty acids, antioxidants, and certain minerals like zinc and magnesium can support hormone balance and improve circulation. Light strength training can boost muscle tone and stamina, which not only makes you feel stronger, but can also enhance sensation during intimacy. The body thrives when it's cared for as a whole, and sexual wellness is no exception. Finally, I encourage women to think about the sensory environment of intimacy. Lighting, music, scent, temperature. These details matter more than many people realize. Creating a space that feels inviting and safe helps the body relax, which is essential for arousal and comfort. Whether you're with a partner or alone, treating intimacy as an experience worth preparing for instead of something rushed sends a message to your brain and body that it's valuable. And that shift in mindset often changes the way the entire moment feels. In my years of working with women over 50, I've learned that one of the most transformative, yet most challenging, aspects of sexual wellness is rebuilding confidence. Many women have carried subtle insecurities for decades, but after menopause, these insecurities can grow louder. Changes in weight, skin texture, hair, or muscle tone can make you feel less like yourself, and that self-consciousness can become a barrier to intimacy. I often remind my patients, your partner doesn't see you with the same critical lens you use on yourself. They see the woman they care for, the woman they desire, the woman they've built a life with. But more importantly, you have the power to change the way you see yourself. Rebuilding sexual confidence starts long before you step into the bedroom. It's about re-establishing a sense of comfort in your own body in everyday life. That might mean finding clothing that makes you feel attractive and supported, not just practical. It might mean prioritizing skincare, not because it erases time, but because it's an act of self-respect. It could be as simple as wearing a fragrance you love, or as involved as taking a dance or movement class to reconnect with how your body feels when it's in motion. These seemingly small steps can have an enormous impact on how willing you are to let yourself be seen and touched. I also want to address a truth that many women hesitate to admit. Desire doesn't always appear on its own. After 50, you may need to invite it in, and that's not only okay, it's normal. Scheduling intimacy might sound unromantic, but in reality, it allows you to prepare mentally and physically, creating a sense of anticipation instead of pressure. Think about it the way you think about planning a special meal or trip. The preparation itself becomes part of the experience. In my practice, I've seen couples thrive when they treat intimacy as something to be nurtured intentionally, rather than waiting for it to happen spontaneously. Another important piece of the confidence puzzle is communication, not just about what's comfortable physically, but about what you enjoy. Too often, women over 50 tell me they've been quiet about their own pleasure for years, focusing instead on their partner's needs. This silence can create a slow erosion of desire because you're not actually engaging with intimacy in a way that satisfies you. Learning to speak openly about your preferences, fantasies, and boundaries is not selfish. It's essential. In fact, many partners feel relieved when these conversations happen because it takes away the guesswork and replaces it with collaboration. For those navigating intimacy without a partner, confidence still matters deeply. Your relationship with your own body shapes how you experience pleasure, whether through self-touch, mindful movement, or even non-sexual acts of affection like massage. Exploring what feels good for you, without shame or urgency, can be one of the most liberating experiences in this stage of life. It reinforces the truth that sexual wellness isn't something another person gives you. It's something you own, cultivate, and carry with you, partner or not. One of the most surprising things I've seen in my practice is how quickly confidence returns when women start small. A patient who once avoided all intimacy because of discomfort may, within weeks of making a few changes, using a better lubricant, practicing gentle stretching, adjusting the timing of intimacy, find herself initiating closeness again. Another, who felt invisible in her own marriage, might discover that a heartfelt conversation and a conscious effort to add more non-sexual touch, hugs, holding hands, a shared shower, completely shifts her sense of connection. These are not grand gestures. They are consistent, intentional choices that build trust, comfort, and ultimately, desire. If there's one thing I want every woman over 50 to take from this, it's that sexual confidence is not about looking a certain way or meeting some cultural standard. It's about feeling at home in your own body, knowing what you need, and being willing to pursue it without apology. Once you start seeing yourself as worthy of pleasure, you'll be amazed at how your body and mind respond. And this isn't just theory. I've seen it happen hundreds of times, and I've experienced it myself. Confidence, like desire, is something you can grow at any age. And when you do, it changes far more than just your sex life. It changes the way you live. If there's one truth I've learned after decades in medicine, it's this. Sexual wellness after 50 is not about reclaiming who you were at 30. It's about embracing the woman you are now and giving her every tool she needs to thrive. This stage of life can be one of the richest and most satisfying when it comes to intimacy, but only if you actively invest in it. Too many women think that desire fades simply because of age. In reality, it fades when we stop nurturing it, when we let habits of neglect or silence take over, and when we accept discomfort or disconnection as just how it is now. I'm here to tell you, it doesn't have to be that way. We've already talked about the physical aspects, hormone changes, circulation, pelvic health, and comfort, And we've explored the emotional foundations of desire, including self-image, stress, and communication. Now it's time to combine these pieces into something sustainable. The women who experience long-lasting sexual vitality after 50 are not the ones who make one big change and hope it sticks. They are the ones who create daily and weekly habits that keep their bodies responsive, their minds open, and their relationships, whether with a partner or with themselves, alive and evolving. One of the simplest yet most powerful habits is movement, not just exercise for the sake of burning calories, but movement that keeps your joints supple, your blood flowing, and your pelvic floor engaged. Whether it's a morning walk, a dance class, gentle yoga, or resistance training, every bit of physical activity you do is an investment in your sexual health. It improves your energy, your mood, and your ability to experience pleasure. I've had patients who came to me convinced they needed medication to restore their desire, only to find that regular movement alone reignited it in ways they hadn't felt in years. Nutrition is another cornerstone. The foods you eat influence your hormones, your blood sugar, and your overall vitality. A diet rich in lean proteins, omega-3 fats, antioxidants, and plenty of colorful vegetables supports not just your heart and brain, but also the tissues and systems involved in sexual wellness. Hydration matters too. Dehydration can reduce natural lubrication and make you feel fatigued. Small, consistent dietary improvements can have a surprisingly large impact on how responsive and energized your body feels. Then there's the art of keeping intimacy alive. For couples, that means consciously creating moments of connection, even outside of the bedroom. A shared meal without phones, a quiet walk in the evening, or even simply holding hands more often builds the emotional closeness that fuels physical intimacy. For single women, this means creating a sensual life for yourself, wearing fabrics you love, spending time on personal grooming, exploring touch without pressure or judgment. Pleasure should not be something you're waiting for someone else to initiate. It should be something you're cultivating in your daily life so that when opportunities for intimacy arise, your mind and body are already open to them. I also encourage women to have ongoing conversations with their healthcare providers, not just when something is wrong, but as part of routine care. Too often, sexual wellness is treated as a side topic, an afterthought. But if you don't bring it up, many doctors won't either. Ask about pelvic floor therapy, hormone testing, or safe lubricants. Discuss any medications you're taking that might be affecting your desire or comfort. Being proactive about your sexual health is as important as being proactive about your heart, your bones, or your vision. Lastly, I want to leave you with this. Intimacy is not just a physical act. It's an emotional and psychological expression of connection, trust, and joy, even if that connection is with yourself. At 50, 60, 70, and beyond, you have a lifetime of experience, wisdom, and resilience to bring into your intimate life. That depth can make your relationships more meaningful, your experiences more fulfilling, and your confidence unshakable. But it doesn't happen by accident. It happens because you decide your sexual health matters enough to prioritize it. So, if you take nothing else from this conversation, take this. You are not too old, too late, or too far gone to experience deep, satisfying intimacy. Start with small, consistent changes. Keep learning about your body. Communicate openly. And most importantly, see yourself as deserving of pleasure, comfort, and connection because you are. And if you found these insights valuable, I encourage you to keep this conversation going because your journey to sexual wellness is only just beginning.